Another burning question. Is it meaningful to invest our time to create personal branding, or should we focus on branding ourselves for each job? I hate this question. You go with the passion. Uh, branding. To me, I'll be honest, the branding to me comes from like, well, what do you love to do? What's the skill set you enjoy? Do you love the data analysis, evaluation, community outreach? You know, there was someone earlier, I think before you came on, Patricia and I started talking about she loves environmental health and the research aspect of it. So I'm like, okay, that's what you love. Like, but this whole branding thing, it's like, no. I mean, it's a philosophy, right? It comes from like, and I've never had to quote unquote brand myself to get a job. So no, I don't understand what that even means. I'm here to just look for a job, understand where they're coming from, and then mirror that back to them within reason. Like I'm not gonna lie to them. I never tell anyone to lie. But the way that these companies talk amongst these sectors, imagine if you're gonna brand yourself, try branding yourself against hospitals, nonprofits, corporate, universities, consulting groups. Like that actually makes more sense to me because there is a way you approach a corporation versus the way you approach a nonprofit, right? But that's as far as that. I'm like, besides that, I don't understand what branding is referring to. That's
Yeah,
my
it
two
seems
cents.
confusing to me because every networking event or job search event I go to, like there's always a session about self-branding, and it's like I
Ugh,
heard that it helps you market yourself, but yeah, my question is like to whom, right? It's like it has to be grounded,
exactly.
yeah, industry or the job. So I haven't
I think it
spent
makes sense
time.
for I think it makes sense for some industries, like if you're in some sort of sales or some sort of like I just feel like with public health, this is why it's so hard to get a job is because, and it's not even about like ability. I remind you guys, I think I did a little reel about it. It's like it's not about if they smiled or if they like you or if, like no, it's can you speak the way we speak, right? And what does that have to do with branding? Like it's a whole different thing. So yeah, you set me off on that one, Yuko. I was not ready for that question.
Okay, so no branding, but just sounds like self-reflection
If
of
you
like
want to do
you like.
branding and you want to explore that for yourself, go ahead. In fact, I explored that myself at one point just to see. And at the end of the day, it was still me having to hold up the conversation in the interviews. Like it's, I don't really felt like it was. And it makes sense after a certain while if you're like, well, I have a certain track of this and I really want to be known for this. It's like, all right, well, do you want to be known for that? Or do you, you know, it just depends on where you are in your job. Obviously, for me, I want to be known for career development and strategic planning. So to me, that makes sense as far as like, right? But like I'm not also looking for a job in the same way that you guys are. So I just want you to be mindful when people say branding, it's like, for what? For what? Yeah. I think
Yeah,
that's a healthy like challenge. Like, okay, but for what? Okay. Senior specialist member in community interventions. Oh, that's a new way of describing the work. I mean, it's still Medicare, Medicaid. Oh my gosh, it's it's still nursing, but the way that they're talking about the work, prevention specialist, HIV prevention. Oh my God, yay. I love when I still see HIV work being funded. Sales, sales, sales. Yeah, quality improvement. Yes. Okay, so let's see if we can move the conversation towards the end a bit around this, is like, if you can describe the work more and the process, right? Because quality improvement, process improvement, practice improvement, um, all of this is of high value to these companies. Like if you're comfortable in that space, unfortunately they want someone who's licensed in this one, and it is behavioral health, so that sometimes happens. But don't give up on the term quality improvement, because I do pull like quality program strategist. Is that one something yeah, we've already, I think it's already on job alerts, that one. Quality outreach coordinator. This is a health plan though. Managed care, medical office setting. I'm not knocking on it. I think just a lot of us aren't necessarily looking for that. And it depends on, first of all, if you're in Texas, second of all, if you want that entry level. So I'm not like, I just know a lot of us in here want, oops, not just so like healthcare enrollment related, more community program related at least, or community focused. PHI. I think we promoted this one already, yeah. Quality improvement, more health. Sometimes you run into like Lean Six Sigma. Here it is. If you've been looking at it, eyeing on it, I know that the Sisters in Public Health group offers these classes, so you can check them out. There's other places that offer it. But yeah, this is still pulling a lot of healthcare. Population health, by the way, is referring to is not referring to public health. Population health 99% of the time is referring to the members of that health plan. The members of the health plan is the population they're referring to in these titles and in this job. And Oak Street Health, I believe, was bought by CVS Health. So just be mindful of how you're reading these and don't just assume population health means public health. All right, terms that are popping, I think, are still like knowledge management, or at least they were for a while. Human research protection program analyst. I don't know if we promoted this one already, but does want IRB. Some of you have research background. Oh, search IRB. Patricia, if you're still on here, anyone who is interested in research, you can search
Yes, I'm here.
IRB.
Can you share,
Yes,
please?
yes, search IRB. Well, I know your work isn't necessarily about human research, but if you want to find more research related roles and how to get your hands on research, period, you can search IRB or knowledge management as well. But IRB is usually they want someone who has that, who is comfortable in that space. IRB administrator, stuff like that. So some of you are interested in that. That's another way I would search. Let me go back to the other one though, because I wanted to do knowledge management. So yeah, if anything, I wanted to do this with you guys so you guys realize it's tough out here. Like period. So you have to get resourceful and savvy on how you're finding them. Obviously, grow your network on LinkedIn. Obviously, network as you want. Like, I'll be at Nate Show in July for anyone who's coming to Nate Show or knows someone who's coming to Nate Show in Anaheim, the National Association of, in fact, I'll put it up here. Oops. No, what did I do? Nate Show Conference. The National Association of City and County Health Officials. This is where like your public health officers will be going all over the cities and the counties. So it's the national level conference and it is in Anaheim. I will be there in July. It's the 14, 15, 16, 18. But anyways, if you find opportunities to network, engage, obviously go, do what you can, but also on LinkedIn, make sure you're making friends because that is how your algorithm basically improves. So